Public health officials are warning of a spike in whooping cough cases making their way through the area.
Valley News Team's Ethan Kramer has details.
A highly contagious disease is making its way through Cass County.
Pertussis is a highly infectious disease.
Pertussis, aka whooping cough, has created an outbreak at a local daycare, and it has also hospitalized one individual. Dr. Tracy Newman, a health official for Fargo-Cass Public Health, says the rapid number of cases has gotten their attention.
How rapid it's increased since in the last 6 weeks has gotten our attention.
In a press release sent out by FCPH, there have been 15 cases reported since August 1st, and Cass County only typically has 5 to 8 on average in a typical year. Dr. Newman says the uptick started because of school being back in session.
I think as children re-entered school buildings and childcare settings, we've now seen a significant uptick.
Symptoms of whooping cough are violent coughing, sneezing, nasal discharge, fever, and sore, watery eyes.
Our most at-risk and vulnerable populations would be like infants under the age of 1 or really newborn infants who are too young to be vaccinated. So we really urge the community who may not even know they have pertussis, if it's presenting as a mild cold, to be vaccinated and take precautions to keep our elderly, pregnant people and infants, really safe.
Dr. Newman had a couple pieces of advice for anyone who may not have their updated whooping cough vaccines, or if your child is feeling sick.
Please make sure vaccines are for sure our number one safe and effective prevention for pertussis. If your kid is sick, please stay home, right? Try washing your hands, good nutrition. We talk about respiratory etiquette, coughing in your elbow.
In Fargo, Ethan Kramer, Valley News Live.
Health officials say pertussis is a reportable condition to the North Dakota Health and Human Services Department, which will conduct contact tracing if needed.